8:53 Central African time, and we're going to be switching gears now to a very, very concerning and important conversation. Over the past few weeks, not years, few weeks, South Africa has witnessed one of the largest movements of people in recent history. Thousands and thousands of foreign nationals have either been deported or have chosen voluntary repatriation. This is amid heightened anti-immigrant tensions and government operations. But beyond the politics, and this is something that I don't think is spoken about enough, beyond the protests and the immigration debate, lies another story. One that really makes the headlines. Government says, I think in this past week, more than 53,000 foreign nationals have been deported or voluntarily repatriated since around mid-June. While humanitarian organizations have warned that many people returning home after experiencing the protests and the displacement that have come with this conversation around migration and the many disruptions to healthcare, there's been another conversation that's been propping up. Health experts are now warning that repatriation is not simply about just crossing the border or busing people to their countries of origin. It can also interrupt life-saving treatment for people that are on ARVs, for instance, or TB medication or any other chronic illness. And that has put, I think, quite a lot of trauma and makes one think of what could happen to all of these people who are already vulnerable to further health risks. The reports comes from aid organizations to describe cases of people traveling without any kind of medication, pregnant women lacking care, and children missing routine immunization. I think we saw outside some of these consulates, there were women that were giving birth outside. So now the question is, how do we balance a country's right to enforce its immigration laws, which is very important and you can't, outrule it. But how do we balance that with humanitarian responsibilities? And are we fully appreciating the long-term public health consequences of the current crisis? We're going to be joined by Dr. Rebecca Walker, research consultant at the African Center for Migration and Health out at Wits University. She's also the co-founder of the Collective Voices for Healthcare Access. And she's going to be giving us insight on what they saw or what they think is going to be happening as more and more people are being repatriated. And many of those carry, I think, illnesses and chronic diseases that need to be taken care of. Rebecca, thank you so much for joining us. Welcome to News and Views. Really appreciate you giving us your time.
Morning, and thank you for having me on your show.
No, pleasure is all ours. Doc, I want to jump right into it. When people hear the word repatriation, they often think about immigration policy. South Africa in this case, specifically us. People think, okay, this is government finally enforcing, migration policy and taking a hard line or hard stance on illegal migration. Why do you believe it should also be viewed as a public health and humanitarian issue in the same breath?
So I think we need to start with the term repatriation itself, because repatriation implies people choosing or at least consenting to return home. And what we're actually seeing is forced removal under the threat of violence, often without an individual assessment, whether that's sort of people's documentation status or their healthcare status. So that's deportation, but it's deportation without following the formal legal process. So we need to be clear on that at the beginning, because when we talk about people returning home, many people who are going, their home is South Africa. They've grown up in South Africa. They've made their lives in South Africa. They've built businesses in South Africa. And suddenly they've had that entire independence taken away from them and been put into this forced state of dependency, which is now the humanitarian crisis that we're hearing about. And of course, that's going to come with its, repercussions. And what we're hearing from, healthcare workers on the ground and civil society groups and migrants themselves is that the situation is particularly dire. I mean, as you said, there's reports from MSF and various other organizations about sort of what is unfolding. And, we have a government who is measuring the success of so-called repatriation by the numbers of buses leaving and talking about immigration enforcement. But actually, what about the human cost in the process and how that's actually going to impact not just migrants, but South Africa as a whole?
I want to come to what you guys are seeing on the ground from maybe your research and just engagement with some of the affected communities. What would you say are the biggest health concerns facing people being quote unquote repatriated today?
So, I mean, the biggest health concerns are both, physical and mental health. And I think we need to be clear that a lot of these concerns existed prior to the recent waves of displacement because of migrants being refused access to healthcare. But, obviously you have the issues of people who are being transported in buses who aren't being assessed in terms of their health before going on the buses. So those who are on chronic medication for chronic conditions, whether it's HIV, TB, diabetes, not being able to collect their medication before they leave. So that's being interrupted, which is a massive issue, not only to them, but it's a public health issue as well. We've also, there's pregnant women, there's women who are delivering, outside in the cold. There's young children who are being exposed to the elements. And, there's very little evidence or even any that suggests that camp situations are good for people. Being in a confined area, not only kind of the health issues, the physical health issues of that, but mentally the anxiety, the uncertainty. And I think we have to kind of, really think about that in terms of people who were embedded in communities, in networks, in churches, suddenly having to leave everything, their belongings, their entire lives behind them. And, we hear from reports on the ground that, people are only allowed to take like 1 or 2 bags with them due to the buses not having the capacity. So picking which parts of your lives you can take with you. And, if we think particularly about children, I think one of the key things for children in terms of feeling safe and feeling secure is, that their parents are also feeling that. So if children are seeing their parents frightened, they're seeing their parents being treated violently and, forcibly removed, that has a massive psychological toll. And I think much of that we're not going to see immediately because people are in flight mode, but that's going to unfold as, as time goes on. And I think, the additional point there is this isn't just affecting migrants, as I said before. The healthcare workers and those who are working on the ground are being massively impacted by this as well as those communities where their neighbors, where their friends, where their business partners have just been removed. And children going back to school, next week who suddenly realize that 3 or 4 or 5 of their classmates have just gone. I mean, that's hugely traumatic for everybody.
I think when you put it like that, it really does put a lot into perspective. There's another element which I thought, was really, really interesting. When I was doing a bit of reading on this, and again, it's not spoken about enough. The aspect of interrupted treatment. I think one of the biggest warnings is that people living with HIV and TB and other chronic illnesses are now suddenly losing access to medication and healthcare. How dangerous can even a short interruption like this one be? And also, as you mentioned, people are just leaving with whatever that they can fit into these buses, and they don't have any kind of medical records with them. We don't know what's going to happen when they get to, their home countries. That aspect of just having interrupted treatment, how important is it to stress?
I mean, it's massively important. MSF have reported very clearly on this that, TB and HIV patients without medication are not only at increased transmission risk but also of drug resistance as well. And it becomes a public health issue. In addition to the fact that, when you take medication, whether it's ARVs or other medication, you often need to have eaten well, you need to be physically healthy in order to tolerate medication. So people are not only having that taken away, but then they're having their treatment taken away as well. And I think one point to make is, when we talk about HIV and TB, we're not saying, migrants have a much higher rate of this than, the local populations. But it's like any community. If people are removed from their medication, it's going to have huge like personal and community impacts. And I think we saw this much earlier when Operation Dodula were blocking access to hospitals, that people weren't able to access healthcare and access their treatment plans, not just ARVs and other chronic illnesses, but also vaccinations for children, as you mentioned, also women accessing antenatal care. And that, if you deny somebody routine medical health care, what ends up is, an emergency or, a crisis situation, which actually ends up costing a lot more. So if we work on the cost issue, which is often what it comes back to, this is not about, helping South Africa move forward in terms of, creating a better country that's economically a lot better off, because what we're doing is actually creating a great crisis that could have been avoided and is actually going to have massive costs, both, on a personal, community, and economic level.
My next question is, how could it then be mitigated? How could this crisis would have been mitigated? What would have been the correct way to go about, these repatriations, as government puts it? Could it be more organized? Because I think the assumption when you raise such issues, people will say, well, the law is the law and should be enforced, and you kind of a country where you have a big amount of people that are illegal. Something had to be done. Was there a correct way to do it, and what is that way?
Okay, so I think first we have to say that the law cuts both ways. Yes,
Mm-hmm.
nobody's saying we should encourage people to enter unlawfully. Nobody's saying that South Africa doesn't have the right to secure its borders and to have immigration law. That benefits everybody. But the government itself has not been lawful in the way it's working. I mean, we saw it in the Constitutional Court ruling last week that it hasn't been allowing people to claim asylum in the way that the law states it should. Equally, it's not been allowing people to access healthcare in the way that the law states it should. And again, the government's having to be taken to court over its own laws. So we not only see that, but we also see, these vigilante groups who aren't being not only being allowed to do what they're doing, but in some cases are being assisted by the police, are being aided and abetted to go from house to house and drag people out. And so if we're going to talk about what's lawful, we have to look at it in the bigger picture. But I think it's also going back to the fact that people aren't able to access documentation. There is no such thing as illegal migrants. Illegal is an action, it's not a person, right? So you may be illegal in the sense that you don't have the right documentation, but very rarely will somebody choose not to have that documentation. They are not documented because the system is not allowing them to renew their permit. They're stuck in limbo. Many people who could actually access their permits would probably choose to return home now, given the situation. But we have trapped thousands of people in this state of illegality and then blame them for it. So in terms of sort of how this could have been mitigated, I mean, there's so many lessons that could have been learned. And we saw it in 2008, with the violence breaking out then. There needed to be very, very clear messaging about who is responsible for the causes of the challenges in South Africa, for the unemployment, for the rising poverty, for the overburdened healthcare. And unless government very clearly and categorically says that it is not migrants, which it isn't, because the data and the research, and I know people say that it doesn't always reflect live realities, but we have very, very strong, clear data year after year after year of migration trends, of numbers who are coming in and out. So, we can't go by perception. We have to go by what we actually know. And, if we're not, we need those statements that actually puts that forward, rather than just saying, well, violence is wrong, but we have a problem with illegal migrants, because that's what was said. And so that immediately plays back into, the situation that we see unfolding. So one, we needed those clear messages. Two, we needed the government to enforce the court rulings about allowing migrants to access healthcare, stopping Operation Dodula and other organizations from blocking access, stopping people from chasing people from their homes and, forcing them into this state of expulsion. But now that we're here, We need to acknowledge that, we've got this situation, but there are still safeguards that can be put in place. People need to be checked before they're bused to Messina, and those who need medical care, receiving medical care, not just from volunteers or from MSF and other organizations who are filling the gaps, but from, provided by the government itself as well, because the welfare and the dignity and the health of people who are being removed, should be paramount. And we need not a focus on, what the so-called success of these camps and how effective it is. We need to actually enable people to remain in their communities and address the reasons why they're being forced out, because none of this is a solution to what's happening in South Africa right now. And 1 year on, we're going to say how many thousand left South Africa. We're not going to suddenly have the gap in inequality is closed. We're not going to have unemployment below 10%. We're not going to have functioning health systems, because we're not dealing with the root causes.
There we go, Dr. Rebecca Walker. Thank you so much for giving us your time and for those very, very important insights. I really appreciate your time.
Thank you. Thanks for having me on.
Research consultant at African Center for Migration and Health out at Wits University. She's also co-founder of Collective Ways of Healthcare Access, Dr. Rebecca Walker. Yeah, and giving us, I think, a very, very important insight on the impact, whether psychologically, physiologically, of some of these repatriations, as government puts it. And we don't think about it enough, eh? People that are suddenly cut off from treatment, pregnant women, people that are taking chronic medication. What happens once they get to Messina and they have to wait weeks and weeks and weeks on end at the border, waiting to be repatriated? Going to take a quick break. News and views will be back with you after this.